Hello, I'm Sean Park, prosthetic urologist practicing in Seoul, South Korea. I recently attended the SMSNA meeting in the US. I was in Grapevine, Texas. The reason why I go to the SMSNA, personally, I think they are the best academic meeting for penile implanters like myself. Among the urologists, some focuses more onto the medical treatment, and some focuses more onto the surgical treatment. A guy like me, definitely, I do most of the treatment in the surgical care. So I want to attend the meeting that talks about the surgery. Major, part of the talk, I wish it to be a surgery. And the SMSN is right in the center of that. This year I was invited to talk about how I do my penile implant surgery in my outpatient setting, my outpatient clinic. Obviously, in the eye of the US surgeons, it's a very different thing because most of the surgery in the US or other places are done in the surgery center. But however, in my country, all South Korea, if I am going to do a surgery as a private practitioner, we don't have a surgical privilege. We have to have our own OR, our own facility should be ready for the surgery. And it was a great talk for me as well. The response was really great. They said that all the costs in the US went up too crazy and the patient has a low accessibility and the surgeons doesn't really do great with the surgery centers or high expenses. So if they can manage the surgery inside their OR, things will get much better. That's what one of the comment was from the listeners. So I think heterogeneity is really important. We need to experience different people's opinions with their different settings, how they do and why they do it, things like that. With that, we can apply to our own settings and then make it better. So this was really, good exposure for me. Other thing I really enjoyed at SMSNA is that SMSNA always prepares something for the newcomers, like residents or fellows, those who are starting. So, young clinician mixers or cadaver labs, especially cadaver labs seems to be a great event for surgeons like us or for new beginner surgeons like the residents or fellows. Usually what's happening is that if you get trained by a certain facility, you tend to see only your professors or your teacher do surgery. But that's not optimal. To be a sound surgeon, you need to see how others are doing as well. For example, you need to see scrotal approach, penoscrotal approach, infrapubic approach, subcoronal approach, or perineal approach. And you need to see different brands like how the Coloplast do, how the AMS do, how the Rigicon do, all these things. In the cadaver labs, what they are doing in the SMSNA, they have a huge lot of cadavers and then they set certain surgeons who excels in the certain parts like penoscrotal table, infrapubic table, subcoronal table, something like that. And the trainees rotate the table so that they can experience various kinds of approaches. I think it's a fantastic way to expose and train and make them more intrigued at the same time. And I was really having great joy of doing the training and talking to new surgeons. I still remember how I was when I started. And those who helped me it was a huge help. Something trivial they said impacted me, immensely. And I wish we could do something similar like that in my country as well. This event, again, makes me understand why it's so important to do academic activities, including research and education. Those two things will enhance your clinical abilities, especially in days like this. Information is kept pouring, and it is so easy to be delayed. And being delayed a little bit won't be a problem, but if you delay it quite a bit, you won't be able to deliver optimal care to your patient. Also, you need to see other surgeons, respected surgeons practice at least once in a year or two. It was a great joy to share what I see. Hopefully, doing these activities could result in a better contribution to the field of my penile implant, and I'll try my best to provide the best care I can deliver.